Hi, my name is Chrystal Stinson. I'll be performing a speech on cardiopulmonary resuscitation. I am a student, an LPN student in the RN program at Herzing University. Cardiopulmonary resuscitation is an essential life-saving skill that everyone should know and practice. Cardiopulmonary resuscitation is a simple procedure that increases the chances of survival by 3 times. The more people that know CPR and actually use it in an emergency, the higher the survival rate. It is time Americans take each other's welfare as serious as we do our own, and depending on the healthcare workers is no longer an option. How many times have you been in traffic and you notice an accident and you see that there are victims, and instead of rubbernecking and instead of just adding to the traffic situation, sometimes they need help. If there's no emergency services there may be people that actually need help. CPR increases the likelihood that the heart will resume an effective rhythm. So when you provide CPR to somebody, though the circulation is a small amount, it is enough to keep the heart going. Witness reaction is critical when someone suffers a cardiac arrest. If every minute that goes by without CPR decreases the chances of survival by 7 to 10%, and that's per the American Heart Association. There are 4 links to the chain of survival per the American Heart Association. The bystander can perform the first 3. The first one is to recognize that there is an emergency. The second is to call 911. And the third is performing chest compressions, which is where you take your hands and you press fast and hard on the heart 30 times. Hands-only CPR has now been created by the American Heart Association. Med.net will show you several procedures where if there's a risk of infection or you're kind of nervous or hesitant to perform CPR, you can just literally press on the chest. Just keep pressing. Just don't stop. You don't have to do the breaths if you don't want to. You just keep pressing on the heart, because that is still sending blood circulating to the heart, and that's what is the most important part. When you do that, you do not stop, you do not do anything until actually someone else is able to take over or the person is resuscitated. The statistics show that 80% of cardiac arrests happen outside of the hospital. So the person that you may be saving, or the person that you will save, will most likely be someone that you love. It could either be a grandparent, it could be your child on the soccer field and they have trauma to the heart, or it could be your child is just running and playing and for some reason you don't know why, but there's so many deaths where they just lose heart and lung activity. And in that instance, you can perform CPR and save their life. Per the Mayo Clinic, in a study in 2011, 70% of Americans feel helpless in an emergency. You don't have to feel that way. Knowing and performing CPR is a very simple and a very easy thing to learn. You can go to theheart.org, which has a website. It provides a 1-minute video of how to perform CPR. There is now something that's called beattheheart.org for teenagers. They can learn CPR per a video game. They have interesting ways that they can learn it per a puzzle. It tries to make CPR interesting. Take a minute and save a life. It's not that hard. You just literally watch the video for 1 minute. You can listen to me for 1 minute. I'm going to provide you with handouts. You can read those. And literally, CPR is not something that has to be done so precise. It just has to be done in an emergency. So really, the subject that I'm talking to you about today is a subject of responsibility. It's time that we all stand accountable for the well-being of each other and each other's families. CPR gives the heart the jump start that it needs, and don't be afraid to act. Learn CPR. It will save a life, most likely the one of someone you love. Take the responsibility of knowing what to do and doing it. And I can't tell you the feeling of having someone's life in your hands and saving it. And being a nurse, I have performed CPR several times successfully, and there's nothing like being able to call a family member and saying well, your family member lost consciousness and they lost their heart activities and they didn't have any vital signs, and we performed CPR on that person and we did get their vital signs back and they're now at the hospital, and for that person to live, that's an awesome feeling. And if you can do that to a loved one, it's even more awesome. Thank you for listening.